Hello, my name is Taylor Martin. I'm a nursing student at Lander University in South Carolina, and today I'm going to be talking to you about the country of Kenya. This is my country health status report. So, Kenya is a country in East Africa, and in 2018, its population was 51,393,010. So overall, Kenya has a poor health status, but it has improved drastically over the last 10 or so years. And according to the Institute for Health Metrics and Evaluation, HIV and AIDS has been the leading cause of death of people in Kenya in 2007, and this also remained unchanged throughout the next 10 years, going on to 2017. And although HIV and AIDS is still the leading cause of death in Kenya 10 years later, the mortality rate caused by HIV and AIDS has decreased by 52%. And this is a great change, and a lot of this is due to safer sex education. So, educating the citizens of Kenya to use condoms during sexual intercourse and to be knowledgeable of who they are having sexual intercourse with and the amount of partners that they have. And this, again, is coming from the Institute for Health Metrics and Evaluation. And also, after HIV and AIDS, the other leading causes of death for 2007 through 2017 were lower respiratory infections, diarrheal diseases, and neonatal disorders, as well as tuberculosis. And in 2000, the life expectancy for men was 54 and 57 for women. In 2010, it was 59 years old for men and 63 years old for women. In 2017, it was 63 years old for men and 69 years old for women. So obviously the life expectancy is increasing, which is a great thing. So this means that people are living longer, and this just shows that the health status has improved recently. So an overview of the country's health system. Kenya has an overall health that is struggling. The system is struggling. And so one example of how they are struggling is that for every 10,000 citizens of Kenya, there is one doctor. So there's a huge gap in the ratio of doctors to patients or doctors to citizens, so that obviously there's a shortage in healthcare providers. In addition to this, about 40% of doctors leave Kenya every year to find opportunities in other countries. Doctors and nurses have poor wages as well as poor working conditions. So comparing the health status and health system with the United States, so overall, the United States focuses on preventative health care. So we have well child exams and yearly screenings for various diseases in the United States, whereas Kenya has a more reactive healthcare system, since many residents and citizens of Kenya cannot afford health care and do not have health insurance. So basically in Kenya, people do not go to their doctor annually or on a regular basis to do checkups. They just wait until they get sick and then get treated for that sickness or illness or injury. And another difference between the United States and Kenya is that the U.S. has a high income according to the World Bank, and Kenya is a lower middle income status. And this just shows that the United States has more resources and more economic availability than Kenya does, and this is directly related to their healthcare status. So some recommendations for improving health that I have. The main recommendation that I have for improving the health in Kenya is to increase the funding for primary health care in Kenya. According to one article that I read, Kenya is more of a reactive rather than a preventative healthcare system. So this goes back to what I was saying a minute ago about how Kenya has more of a reactive healthcare system where they wait until they get sick or injured to see their primary healthcare provider or emergent care facilities. And I believe that improving the funding for primary health care, so just rearranging the funds for health care from the government, that primary health care would help overall the health status in Kenya. So on to the next bullet, I have primary and preventative health is one of the key ways to reduce mortality and morbidity, in addition to reducing costs for the patients and providers, yet it receives the least amount of funding in Kenya. And this is from that same article that I was talking about. It receives the least amount of funding and just receives, overall, it would reduce the amount of costs and amount of visits for healthcare providers. Another recommendation that I have for improving health is to improve the water sanitation system in Kenya, which is the main cause for many of the diarrheal diseases. And like I said earlier, diarrheal diseases are is the third leading cause of death in Kenya. And another recommendation that I have that is already shown to have benefits is to continue the safe sex education to further decrease the prevalence of HIV and AIDS. And I already mentioned this, but the World Bank categorization of Kenya is lower middle income. The impact of culture, religion, economics, and government, these four things have a great impact on healthcare no matter what country it is. But in Kenya, economics is one of the big impacts, so where healthcare workers do not get paid enough. And in addition to that, patients and citizens do not have enough funds to pay for their health care. So that's just another aspect of economics in Kenya. As a result of this, doctors and nurses have had strikes, lots of healthcare strikes in the past. Particularly in 2017, there was a doctor strike that lasted 100 days and a nurses strike that lasted over 3 months. And culture in Kenya is very rich. They have a rich culture of music and dance, and that just helps with the coping and preventative health care. And the government is another big aspect of Kenya, since they provide the funding and decides where the funding goes for healthcare. And then, like I was talking about, the primary health example of that. So my interview for Kenya was with Franny Weiland. She is a fellow nursing student of mine, and she volunteered for a month in a pediatric ward of a Kenyan hospital through a third party. She participated in outreach programs to rural areas and provided community health screenings and education. According to her, the healthcare differed very much from the United States, and also within Kenya it varied from large cities to small rural areas. And in Kenya, she reported that the role of the nurse is very different, where the role of the nurse consisted mainly of administering medications, and that shows a difference between the United States and Kenya. Whereas in the United States, the nurses perform assessments and create care plans, but in Kenya, the doctors perform those roles. And she said that the American healthcare system showed more autonomy, especially towards nurses. And some things that she saw in Kenya during her time in the hospital were large cases of HIV and AIDS, people with lasting effects of polio, also scoliosis, cataracts, hypertension, burns, abscesses, pneumonia, malaria, malnutrition, cellulitis, and renal failure. And one thing that she saw was that economics was the primary factor that influenced their delivery and reception of healthcare. And people who were better off financially could afford to take themselves or their family to a doctor when they were sick. And if the people couldn't afford healthcare or were in a rural region without available healthcare, they suffered in return. And she said in those cases that natural remedies were utilized. And these are my references for this project. Thank you.